Hey all, I'm Dr. Bruner at HealthSource of Ohio, and
Ciara.
Ciara is a grad student working with me.
Yeah.
So one of the things we're most excited about with our new postdoc fellowship program is all the opportunities that you as a fellow will have to work with and cross-train with our medical students and our medical residents. So this is something that Ciara has been guinea pigging for us, and it's been going really well. So I thought I would have her tell us a little bit about some of the things she's been doing. So first, you've been working with the medical students, and you're doing two different things with them.
Yeah. So the medical students here, they have small groups every week where they go over a case together and they all share their own case experiences in clinic. And I've been attending that about once a month. And I just provide a behavioral health perspective on things, just to have a different view outside of like medical perspectives. So that's what I've been doing with the medical students, and the med students have been coming and shadowing me when I'm at clinic here at the Batavia office.
That's awesome. Yeah, I just talked to one of the medical students yesterday. She was shadowing me, and she had some really nice things to say about you. And Dr. Shanahan, who is the director of clinical training for the medical students, was literally at a loss for words in terms of how you did with that. So that was pretty cool. And I would just say that with the small group, you've got a lot you're trying to balance, and you're a practicum student. You can only do so much, but our fellows probably be able to do that more than once a month. They would have us every week if we could do that. So then you are also doing some things with the residents, right?
Yeah. So I also, we're doing didactics with the residents. They've shown a lot of interest on learning more about behavioral health things and how to treat different conditions in primary care. So we've been doing didactics. I think we have a couple planned for weight management, smoking, was smoking one?
I think so.
And then we've done previous didactics on just the PCBH model and Appalachian culture, since most of our patients are of Appalachian culture.
And just like professional development stuff, like on giving and receiving feedback. It was not something, we didn't think we were going to be doing this many, but because they were so interested, we've got a bunch more on the schedule now, which is pretty great.
Yeah, it's been really fun interacting with the residents and kind of seeing them over time get more comfortable with the PCBH model and being more interactive in the model.
We've seen them refer more patients to us and do more handoffs since then too, which has been great.
It's been cool.
What else are you doing with them?
So I'm also doing a ballot group with them, and this is something Dr. Bruner threw me to the wolves to do. But it's been a lot of fun. So basically, I've only done it once, but I hope to do it a couple more times before I leave here. Basically, I meet with the medical residents, just as me and them. There's no other clinicians there, no preceptors, and we just really have a process group about patient interactions with the goal of really reflecting on anything they bring to the table and what the patient might be doing that is stirring some feelings in them and how that's affecting their care of the patients. And that was something that I thought was amazing.
Yeah,
and
you really enjoyed that.
They loved it, and it was really interesting to have them just reflect more on like, oh, like, because this patient's doing this, it's stirring this feeling inside of me that is making me do this. So that is the other thing I'm doing with the residents.
Yeah, and I'm thinking, again, you only have so much time, but our fellows would probably do that about once a month. That's what the residents and their training director would prefer. So, so there is one more thing we have planned that Ciara has not been able to try out for us, and it's something we've done in the past. But our fellows will also shadow our medical residents and then give them feedback and kind of coach them on sort of their bedside manner, their communication, educate on any behavioral influences in what happened in the visit. So we're really excited about that. So I think that covers it. If you have any questions, please feel free to reach out anytime. Have a good one all.